Dear friends, Namaskar. I am Dr. Anil Taneja. Today I will be talking on how can we treat a patient of increased blood pressure without medicines. Since we all know that this is a disease due to faulty lifestyle, so I will be suggesting you the changes that we should make in our lifestyle to control the disease. Number one is change the sedentary habits. Have a regular walk of 30 to 45 minutes daily. If you can walk briskly, very good. If you cannot, just walk at a pace you can comfortably walk. Exercise is to be customized as per the physical and the mental condition of the patient. Young people can do aerobics, maybe running, jogging, some gaming. The middle-aged people, they can do moderate workout, maybe brisk walk or jogging. Old-age persons, they can do just walking at the pace they can comfortably walk depending upon their fitness. Don't walk or exercise with fixing some targets. Don't get yourself tired. Walk, play or exercise in a joyful and relaxed manner. Do some yoga asanas and some stretching exercises. Walking or exercising in unpolluted air near maybe some water source or river or around some trees gives extra benefits. Number two is controlling overweight and obesity. There are two components, exercise and diet. Here, the exercise has to be more of aerobic type. One must pay extra attention to diet. One should take low-calorie diet. Stop all the sugars, especially the white sugar. Stop all the refined foods like white rice, white flour or maida. Refined cooking oil in excess is also harmful. Instead, one should use whole grains, brown rice, multigrain breads, etc. One can also use unprocessed, high fibers cereals like ragi, jaw, bajra, quinoa, millets, etc. A combination of saturated and unsaturated fatty oils are a better combination. Avoid fast foods or ready-to-eat foods. Minimize the use of processed foods. Take more of water, fruit juice or vegetable juice. Skipping meals and fasting also helps to reduce weight. Number three is DASH diet. DASH means dietary approach to stop hypertension. It is recommended to the patients by most of the doctors. This diet is low in sodium, high in potassium, magnesium and calcium. Reduce the intake of salt. Salt may be of any type. It may be sea salt, it may be mountain salt, it may be kala namak or sindha namak. All these salts, they contain sodium chloride. So the use of salt should be minimized. Such patients should not take more than 2300 milligram of salt in a day. In general, one should avoid using extra salt to the dishes prepared at home. They are having sufficient salt. Avoid items containing excess of salt like pickles, chutneys, salty snacks like pakoras or bhujia or bakery items. One can make use of the low sodium salts which are available in the market. Increase the intake of fibers in the diet. Use more of whole grains rather than refined or polished grains. Eat more of raw vegetables and fruits. All fruits are very good, But if you are overweight or you are diabetic, then extra sweet fruits like mangoes, dates, bananas, they should be avoided. Other fruits can be taken. Also reduce the intake of saturated fats. Preferably use low-fat dairy products. Number 4 is sleep properly, preferably for 6 to 8 hours. It will be good if one goes to bed early and rises early. Number 5 is stop smoking. If you cannot, at least minimize. Number 6 is stop alcohol consumption. If not possible, reduce it to the level you can. To manage stress, aggression, anxiety, or type A behavior, here are a few suggestions. Daily, at least twice or thrice, remind yourself of these suggestions and try to bring these things into your day-to-day life, and you will see a gross change. Number 1 is never be in a hurry. If you have less time, it is better to start the job early. Number 2 is have full faith in the Lord and firmly believe whatever He does the best. Always stay happy in His will. Number 3 is don't keep very high goals. Always thank Him for what He gives. Never resent. He always gives much more than we ever deserve. Number 4 is never lose your temper. Never react aggressively to any unpleasant situation. Number 5 is never carry any grudges, hatred, or jealousy against anyone. Always keep the policy of forgive and forget. Number 6 is be flexible, be open-minded. Don't be adamant. If somebody suggests you the right things, accept it, keeping your ego aside. Number 7 is take the life as it comes. Play the ball that is delivered to you. Don't live in the past or future. Live in the present. Number 8 is never try to change others. If you are to change yourself. Number 9 is be polite and humble in your dealings. Always speak politely. Number 10 is must serve the life around you and the environment around you to the extent you can. Do it selflessly. Number 11 is always remember the mortal nature of life and how fragile the life is. We are all like a soap water bubble, which when bursts is gone forever. Number 12, daily spare 5 to 10 minutes or more if possible to read, listen or watch some spiritual talk. It just acts as a psychotherapy. You should try to analyze what are your faults and how can you correct it. If you regularly bring these points into your day-to-day life, you will see a gross change in you in a few days. Other things that help control our stress, anxiety and blood pressure are pranayam and meditation. To get full benefit of pranayam, one should do the pranayams slowly, silently, with closed eyes and with full attention. Do it daily. Meditation. If you are already doing some meditation, continue it. It's very good. But just do it with full devotion and full concentration. All meditations are very good. They yield very good results if they are done with full devotion and undivided attention. If you are not doing any meditation, you just sit for 5 to 10 minutes with closed eyes, unmoved, and just watch your breath with full concentration. Let any thought come and go. This will help you. I am sure if one adopts these steps and change the lifestyle, one will be able to control his blood pressure. In case still the blood pressure is on the higher side, it is better to consult your doctor. You may be needing some medicine. If you have any queries, any suggestion, or you want to share something, you can always write in the comment box or at the given email ID. If you find the information given in this video useful, you can like or share the video, and to receive more such videos, you can always subscribe the channel. May God bless everybody. Thanks a lot.